reasons why a family may decide to pursue palliative care is because they are still working on the cures to the problems that they're facing, and yet they need really expert pain and symptom management services that a hospice can provide so well while they're underway still with their curative treatments and therapies. That's where the palliative care program comes in. We may actually be able to work with someone while they're still trying to find their curative treatments.
Palliative care is chosen by most patients because they're surrounded by complexity of all the different treatments that can happen to them. They're not sure what they want to do. Typically it's somebody who is faced with serious issues and they want to get an idea of what makes sense for them based on what they feel is quality of life.
There are people that are experiencing serious illnesses, and sometimes they're experiencing more than one serious illness at the same time. Palliative care is the ability to provide relief of pain and suffering and symptoms that are really getting in the way of them getting better.
So the benefits would be that it is based on how they're going to thrive the best in their life. It may include very aggressive treatments if that's what they feel they want to meet their goals. Or it may be withdrawing a lot of the treatments that they've been getting. When people come later in the condition, it's harder for them to be actually part of the decision making because they're feeling so badly, and that you're relying on the family more. I think the best time for people to look at palliative care is when they're confronted with a change in their condition. So they're given a new diagnosis that's a serious diagnosis. It can create a lot of psychological angst in having that diagnosis. So that's probably the best time.
As with everything else that's important in your life, patients and their families need to become better consumers. That means that they don't have to wait for someone to present them with the option for palliative care. They ought to be asking for it sooner rather than later.